Good morning, everyone. Good morning, everyone. Wow, that's beautiful. Please just look at the person sitting next to you and say, welcome. You're in the right place. Okay. My name is Dr. Hleza. I am the manager at Adventist Lifestyle Center of the Zimbabwe East Union Conference. We will talk more about that today, just to brief you so that you are aware that there's such a facility. Do we have any visitors that have started coming today? Even though you have registered and you started coming today, we are considering you as a visitor. Wow, that's beautiful. So we're going to ask you to introduce yourselves so that we know you. Yesterday we introduced each other. So this is how you're going to introduce yourself. Let me just give you a mic. So you're going to introduce yourself. And after introducing yourself, all of us are going to give a feedback in greeting. Okay? We're going to give them a what? A feedback in greeting. So let's say they say, my name is Charles. What are you going to say? Hi, Charles. Okay. So that will help you to remember their what? Their name. Okay. So we'll start from my right.
Okay, my name is Tatenda Nyikadzino. I'm fine. How are you guys?
Okay. Thank you. Welcome, Tatenda. Can you please pass the mic to the other two?
My name is Masimba Mwasha.
Hi, Masimba.
My name is Neil Nedley.
Hi, Benuda Dewa.
Good morning. My name is Lydia Makombe.
Hi, Lydia Makombe. All right, so now we know each other. Our bathroom, there's someone else. There's one more. Oh, please introduce yourself.
Yes, I'm the last one. My name is Ropa Fadza Tarambiwa.
Hi, Ropa Fadzo. All right, you are all welcome. Oh, we seem to be having more and more. Praise God. Okay, there's someone at the other end there. Can you please pass the mic to them?
Morning, I'm Ellen Chibika.
Hi, Ellen Jiga. All right. So you're now feeling warm and welcome to this place. Our bathroom facilities are to my left, where there's an exit sign, which is to your right. There is water for drinking in bottles that will be passed to you. If you have not yet registered, please do so at the registration table so that we have
Let us pray. Father in heaven, we come before you once again, bringing glory and honor to your holy name. As we have come this morning, Lord, we come in anticipation that you have a special message for us today. May the words and the teachings that have been prepared especially for us, may they find a place in our hearts, and especially may we use them for the glory and honor of your name. We pray, Heavenly Father, that you'll be with Dr. Nedley in a special way as he delivers the message that he has prepared for us. May your spirit be with him. May you open his mind and his thoughts to exactly that which you present to him, that we may receive your message for today. And so we pray for each participant, every member who has come here this morning. May you bless them with attentive minds and attentive hearts. that we might remember all the lessons that we will learn today. And above all, may we give all the glory and the honor to you. For we pray and ask all this in Jesus' holy name. Amen.
Amen. All right. Thank you for that. Our speaker for today, as yesterday and the other days that are coming, is none other than Dr. Neil Nedley, coming all the way from United States of America, from Weimar University, that house New Start. How many of you have heard of New Start? Just raise hands. Dr. Neil, everybody here before you came looks like they knew about New Start, except maybe just one or two. I also want to recognize the presence of the Zimbabwe East Union Conference president in our midst. Welcome. Thank you for gracing our program. Do we have any health professionals in our midst? Please just raise your hand where you are. Amen. Thank you for coming. Anyone who works, it could be in a church in the health department, just raise your hand. Amen. And all those interested in good health. Wow. Thank you so much. Dr. Nedley, it's your time.
Thank you so much. This is, one of the most exciting things. In fact, we do a lot of, our life is full and full of things that bring fulfillment, but the thing that brings us the most happiness and fulfillment is to see a person's brain completely changed and transformed. You know, we get this idea that people can't change and brains really are stuck and are not going to be able to change. But I've been involved in this work of mental health for years, and every program we see the vast majority of people come with significant mental health challenges and leaving with a transformed brain. And even 20 weeks later, their brain continues to transform. And that's because the brain has the power of neuroplasticity. That means it has the ability to change itself, given the right conditions. And one of the reasons why our brain has that ability to remarkably change is because of our frontal lobe size. The size of a human being's frontal lobe. It sets us apart from the rest of the animal kingdom. A cat, only 2% of a cat's brain is in the frontal lobe. You can't change a cat very easily. And that cat brain is not going to necessarily change a whole lot. Dogs are more changeable because their frontal lobe is 7% of their brain. And chimpanzees have the most of any other animal species. 17% of their brain is in the frontal lobe. But what sets us apart from the rest of the animal kingdom is our frontal lobe size. 33 up to 38% of the human brain is in the frontal lobe. And that gives us the ability to accomplish advanced planning and thinking, and also gives us the ability to remarkably change. In fact, speaking of depression and suicidal ideation is only present, actually, in humans. Animals, no matter how bad their life is, they might have just got run over and they're still living. They will not try to end their own life. Why? Because their frontal lobe is not large enough to reflect upon themselves. This is why also, no matter how bad a child's life is, a child can have anxiety, but depression does not start until the age of 5. And at the age of 5, they start having a little bit more of a frontal lobe to be able to reflect upon themselves, and thus they can get depressed in reflecting upon themselves. And you can even see sometimes suicidal ideation in someone as young as 5. It's unusual, but it's possible. So when I see a patient that has depression and wants to end their life, I actually know that they still have a frontal lobe. And the fact that they have a frontal lobe, I know they can change. I know they can dramatically change. And so just the fact that they're reflecting upon themselves is something that brings me encouragement, because they have enough frontal lobe for me to work with to be able to help transform that brain. Now, we talked about nutrition in the brain. We're going to talk a little bit more about that today, but I also wanted to, the frontal lobe is also the seat of spirituality, morality, and the will. Our program does not neglect the spiritual. It's a vital part of enhancing that frontal lobe for it to be able to change. Although we do admit atheists into our program. We admit people from all different religions, Hindus, Muslims. In fact, in our last program we just finished before coming here, we had 2 Muslims in the program. They were related, father and son, and they were very, what should we say, nervous about coming to a program that has Christian roots, because we're up front over the fact of who we are. And so the Muslim father, he was a physician from Toronto, Canada. And he wanted to talk to me about all the biochemical stuff, but he didn't bring up any of the spiritual stuff to me. I was the doctor. But the person that was admitting them, the person doing the screening, he was talking to her and says, "We are Muslim. We are dedicated Muslims. We are not going to change. We know this is a Christian program. And are they going to try to convert us?" And she assured them that in order to join this religion, you have to ask to join. You're not going to be asked to join. And so that's going to be totally up to you. You're going to have to ask to join. It's a non-sectarian program. One of the things that our chaplain utilizes in the program is the person in the Bible that might be the most non-sectarian person in the Bible that wrote a book. His name is Daniel. The Muslims revere Daniel. They have a monument to him in Uzbekistan. The Jews revere Daniel. Christ, when he was on this earth, said, "Study the book of Daniel." And Daniel has all sorts of mental health issues that are there. There's principles, there's spiritual keys that, and every chapter starts out with terrible things that happened and ends with good things that ended up resulting. But there's a spiritual key that transfers the chapter from disappointment to appointment. And those spiritual keys are ones that people from all religions can endorse. And so it's one of those areas. But anyways, I was shocked when halfway through the program, we're in a doctor visit now, and both the father and the son are there. And the son had some serious mental health issues. He had to be in the hospital for weeks on end. He had all sorts of diagnoses, was on all sorts of medicines, and so they were desperate enough to come to a place that they were nervous about to obtain that healing. But halfway through the program, the father says at the end of the visit, "We didn't know anything about Seventh-day Adventists before coming here. We knew it was a Christian program, but just a little bit about how Muslims, including this Muslim, views Christians. Muslims view Christians as those who drink alcohol, dress provocatively, are okay with casual sex, worship on Sunday, and eat pork. Those are the 5 tenets of Christianity that they know about. And of course, being in this center where there's no alcohol and we're not dressing provocatively, and clearly we're not, participating or encouraging casual sex, and also realizing that, we're not eating pork and those sorts of things, and then seeing that difference, but not just that difference, but also seeing the love and compassion of the staff. And then all of these things making sense. Even the way the book of Daniel was studied, it makes sense. It's logical. So I was kind of surprised at the end of the visit, and he said, "We're very interested in Seventh-day Adventism." And I assured him, I says, well, you would have to ask to join, because we would never ask you to join. And he said, well, that's what we're asking. And I said, well, if you're asking, then we'll be glad. I said, I'll call the chaplain and we'll now that you're asking. He says, yeah, we want to know everything about it. We want to know everything, because we're asking because we might join and we might be willing to do that. So you can imagine the transformation that started to take place in the Father and in the Son during that time. But a little bit about an atheist that came to our program. The atheists want to access the biochemistry, all of those things, but they have this tendency to say, I want to stay out of the spiritual sessions. And I'll tell them, well, you need to still attend, because that'll enhance your frontal lobe, so agree with what you can agree with, and at least that will help. We have evidence that would help the frontal lobe of the brain. So the very first visit, and of course they have to cycle through the chaplain. So this atheist was not just an atheist, he was a licensed professional counselor. And but he was coming because he was addicted to benzos. Benzos are really hard to get off of. And he had been on them for 10 plus years, and he recognized they were causing all sorts of problems. And we had published a study showing how successful the program is in getting people off of benzos. And so he was interested in that. We did a consult, and I actually changed his short-acting benzos, which are harder to get off of, like Xanax, to a long-acting benzo, which is easier to get off of, diazepam, before he came. And so we did a consult, and we were starting to wean that down, but I told him he was going to have to go through the program to be able to get off it after being there for all those years, because once again, as I mentioned yesterday, when you don't have benzos on board anymore and your brain can't make GABA, GABA-aminobutyric acid, which is a neuroinhibitory neurotransmitter, your anxiety goes up by 10-fold. So I don't have a slide for this, but you may want to take notes of this counseling session. The chaplain is he's not only a chaplain, but he understands cognitive behavioral therapy. Now, we do have another CBT therapist that's a pure CBT therapist that they'll also see, but they go through 2 different counselors, and they work on 2 different things, and we have a team where we decide how we're going to divide all of this up in regards to being able to enhance that brain the most and be able to get rid of distorted thinking, which is present in virtually everybody with a mental illness. And so the chaplain, first question, how satisfied are you with your life? And the individual was obviously dissatisfied in a number of areas. He brings out those areas. By the way, this is just a 30-minute visit. It's not a very long visit with the chaplain. The CBT therapist gets an hour. The chaplain only gets 30 minutes. Partly because the chaplain has to see everybody, but the CBT therapist, there's more than one of them, and so they can take more time with the CBT therapist. So it's only 30 minutes with this chaplain. How satisfied are you with your life? Second question. Any of the issues that you're facing, is it because you were not told the truth? Or have you had issues with telling the truth in regards to honesty? That brought up a whole nother area of discussion. Third question. Has anyone taken anything from you, or have you been abused? Or have you taken from someone else, or have you been an abuser? Fourth question. How is your intimate life? You're married. Has there been exclusive intimacy in you and your wife? Brought up a whole nother discussion. Next question. Are you doing anything in your life that you know is unhealthy, but you're still doing it anyways? That's when the benzos came up. Yep, I've been taking these benzos. It's unhealthy. And yeah, there's some other areas too. Then final question. How do you relate to authority figures? How's your relationship with your mother and father? How about bosses in the workplace? Anyone who's an authority figure? And then there are issues there. So that 30-minute analysis, the atheist says, I've interviewed people and done screenings my entire professional career, and you have learned more about me in 30 minutes than I learn about my clients in hours and hours. How did you know what questions to ask? And the chaplain says, I got these questions from God. God explained. He said, I just went through commandments 10, 9, 8, 7, 6, and 5. The atheist says, I don't even know what the commandments are. And the chaplain says, okay, I'll give you your first assignment. Your first assignment is to read Exodus 20 all the way through to the end of the commandments. And then let's come back for the next visit and let's discuss those. Because the principles behind God's laws will actually help us to become very healthy physically and mentally and every other way. Now, as a result of that discussion and other things, our chaplain actually recently wrote a book. His book is Where Christians and Atheists Agree. That's the subtitle of the book. The title of the book is The Law and Its Logic. You know, there have been surveys done in America on atheists. There's a lot of atheists in America. In fact, the core of the, for those of you that kept up with American politics, the core of the Democratic Party are two groups that join together. It's atheists and what we call Jesuit Catholics. The Catholics are divided. I don't know if you know this or not, but Catholics, at least in America, are very divided in regards to how they view things. The Jesuit Catholics are all what we would call progressive. They're pro-abortion. The non-Jesuit Catholics are against abortion. The Jesuit Catholics are pro, or at least very affirming of casual sex. And one of the reasons why Muslims have this idea that Christians are into casual sex is because of the rise of Jesuit Catholicism and then all of the things that go along with that. So the pro-abortion, the LGBTQ, all of those things. And so that's kind of the core principles of the Democratic Party. And you can be assured that whoever is there running for president has those core principles. Sexual freedom, they'll talk about. And so we're used to viewing and seeing those type of principles. But it turns out when you poll the atheists, the majority, vast majority of them, supermajority, meaning that's more than 2/3, actually agree with commandments 5 through 10. They actually believe that you should not commit adultery. That person, even though there were issues in his home in regards to that, he realized it was not good. And his wife, who was also an atheist, realized it was not good. And so the law is logical, and the principles behind the law will actually help us greatly. And of course, it can get to the root of the issues that the person is actually dealing with. Of course, he's not only a chaplain, he teaches in our Masters in Counseling program that help you to be a licensed counselor in California. We're the only licensed counselor university in California that teaches those type of principles in California. Most of them are going to actually be taught by those that are aligned with the Jesuit Catholic way of teaching these principles. So this is, and of course the individual, after reading all of this and seeing the logic behind it, do you think his heart was open to actually spiritual things? Absolutely. He loved the study of the book of Daniel. He loved those things. So, we need to realize a lot of these people that have these beliefs, there's two things that you need to realize. Number one is they may not have ever come across true Christianity. And thus they have rejected maybe false Christianity, and along with that, the false God of Christianity. And so many atheists choose not to believe in God because if they see God represented the way false Christianity represents him, that's not someone that I would want to serve either. And so as we have compassion and as we get to the root of the issue, we can actually start to see the entire brain start to transform as that frontal lobe begins to lighten up. So, by the way, there's even a study done recently. This was because of the blue zones. There's 3 blue zones that Dan Buettner discovered. Dan Buettner is a secular individual. He's not a religious individual, but he was interested in finding where the longest living people were on planet Earth. And the longest living people on planet Earth, where there is an island off of Italy called Sardinia. There was a county in Costa Rica, and they put those two together because they were that way. They were very similar. Then you had Okinawa, a section there of Okinawa off of Japan. And then the third blue zone, which was the longest living group of people, was Loma Linda, California. And it was looking at the Seventh-day Adventists that were there. And that was the only group where their offspring were actually living longer than they were. All the other groups were shortening in longevity. In other words, and of course they had a lot of similarities. What were similarities among the Blue Zones? Plant-based diet. So every one of these, Okinawa, Sardinia, Costa Rica, these ones that were living a long time, plant-based diet. The other thing was exercise. The other thing was a commitment to, outdoors and nature. And then family was important to all the groups in regards to relationships. Relationships are part of our health, and healthy relationships are very important. But then he said, this group stands out because it had a different thing. And he said, I wonder if it affects their health. And the Loma Linda group, what was different about them? Well, there was spirituality in all of the groups to some extent. Yeah, and by the way, that's another consistency. There was a spiritual life that was consistent with all of them. So what was particularly different about the Loma Linda group? Let me pull it up here. So I can quote it. So you see it was Sabbath keeping. And they thought, Buettner just asked the question, could this be helping their health? So in order to do something, you have to do a randomized controlled trial, and you have to have controls and things like that. And so it hadn't been looked at before. By the way, all of the other commandments have been looked at. In fact, we go through that in our program as well. So keeping the commandments actually helps your physical and mental health. And not just the sixth commandment. It's the other ones as well. And of course, those commandments are not just behavioral. The first commandment has nothing to do with behavior, although it can affect behavior. And the last commandment also has nothing to do with behavior. That's why you don't see any laws in any lands that go, that mirror the first and the 10th commandment. First commandment is, thou shalt have no other gods before me. So what should be priority number one? God. The last commandment is, thou shalt not, what? Thou shalt not covet. Covet is not something that we do. It's something that we're thinking. Why does God not want us to covet? Because he wants us to be satisfied. And when we're coveting, we're dissatisfied. And he wants us to be satisfied in our thoughts. That's why that first question, are you satisfied? And so that was really commandment number 10 that was being looked at. But the fourth commandment is behaviorally focused, as are 2 through 9. And of course, the commandment talks about not working. And it's expanded on in other places in Scripture. So it's negatively defined: not shopping, not reading secular magazines, not watching or listening to news or sports programs, not attending secular concerts or theatrical events, not working, not engaging in commercial activities. And this is for a 24-hour period from Friday night to Saturday night. So what did they find after they did these studies? significant correlation between Sabbath keeping and what else? Mental health. Greater Sabbath keeping was associated with more religious coping, more religious support, healthy diet, and more exercise, which in turn were associated with better mental health. However, pairwise comparison showed that both religious coping and religious support each had a significantly greater effect than what? Diet or exercise on mental health. Now, when that study was published, my lights went on because our program at that point was very focused on diet and exercise, as it should be. The science is very clear that those two are crucial in regards to optimal mental health. But this showed something that was even more powerful than diet and exercise. And it was actually doing what? Keeping the Sabbath. They went on to say avoidance of non-Sabbath activities, performance of spiritual activities. That means like going to church, studying the Bible. Performance of communal Sabbath activities were all independently associated with what? Improved mental health. Keeping the Sabbath out of social pressure, however, duty, shame avoidance, performance of secular activities on the Sabbath, or electively thinking that helping people while working for them without pay on the Sabbath was okay, like painting their house, all independently associated with an actual decrease in mental health. And of course, Jesus said something when he was here about the Sabbath. Do you remember? What was the Sabbath made for? It was made for man. Now, as I mentioned here, I didn't mention this. There's 10 different ways of distorted thinking. We teach them that in cognitive behavioral therapy, but one of those distorted ways is disqualifying the positive. And, the commandments, a lot of Christians are aware of those. And this one's in the middle, but they have a tendency to neglect this one, even though it starts out with the word what? Remember. They have a tendency to neglect this one, I think, out of this type of reasoning. At least the people that I've been in contact with for my 62 years of life that have been Christians, this is kind of the way they're thinking. God wants me to be happy. They figure that out. That's true. Does God want us to be happy? Absolutely. They're right about that. God wants us to be happy. And so if God wants us to be happy, he ought to be just perfectly fine with doing whatever I want to do on the Sabbath, so I'm happy. But interestingly, the study showed that if you're one of those people doing whatever you want to do so that you're happier, you're actually less happy than those who actually keep the Sabbath. So we call that a cognitive distortion. They're disqualifying the positive of the Sabbath. They only see it as a negative thing. They disqualify the positive. And that's why God says, taste and see that the Lord is good. Now, another thing that we talk about in our program on the spiritual part is studies show that church attendance also helps mental health. And that's part of prioritizing God, to attend church. So the first 8 days of the program, of course, we have a Sabbath in the middle of that. We start our program normally on a Thursday. We have a Sabbath. And they're actually unknowingly keeping a Sabbath on the third day there. But we don't take them to church or things like that. That's a little too early. A lot of depressed and anxious people are upset at God. They think if God were real, then why doesn't he care about me, and why am I in this bad shape? And so they can have, either they don't believe in God or they have very negative things to think about him. And so we're doing things, nutrition, exercise, other things, studying these 10 cognitive distortions, all of that. And then on Friday, we actually line up each one of the distortions comes about as a result of violation of one of the 10 principles of the Decalogue, which is interesting. It's secular science that discovered the 10 different ways of distorted thinking, but yet that secular science was true, even though it was secular. It was very true science in regards to those 10 different ways of distorted thinking, but they didn't figure out that the principles of the 10 Commandments actually help us to not go into those 10 different ways of distorted thinking. So we line it up there on the Friday evening spiritual meeting. And then we also show them the science. It's not just spiritual things we talk about. We always talk about science with the spiritual on every one of these programs because it needs to be analytical as well. And the analytical part of our brain is our frontal lobe. And so when we put those two together, and then so we say, since church attendance helps, we're actually going to model church attendance before you leave because we want you to, when you go back home, to really consider going to a weekly church service. And in Weimar, California, it's a small town where we're at, there's only one church, and it's the Weimar University Church. So we take them to the church that's right there on campus, and they get to experience that. And those Muslims, by the way, were very interested in attending that after they had been turned on to that. And so we see transformation at all levels when we put science along with the important things of the Word of God. So any questions about what we have presented so far? Not seeing any. I'm going to then finish out our the section I was wanting to finish out on nutrition in the brain. One of the minerals that tends to be an issue in depression is zinc. Zinc has been shown to be effective as an antidepressant alone or in addition to SSRI and TCA medications. SSRIs we talked about yesterday. The TCA are the tricyclic antidepressants. Those are the older ones. They can also work, but they even have more side effects than the SSRIs or SNRIs. But 2 weeks of zinc supplementation increases the HT1 and HT2 receptors. Those are receptors that actually pick up serotonin and help us to be able to tolerate the usual nuisances of life. And the newer antidepressants are actually putting an SSRI with zinc in the same one to try to get more advantageous effects than just the SSRI alone by trying to pick up the receptors. But once again, it's nutrition picking up those receptors and not a foreign pharmaceutical agent that's actually picking that up. Zinc has also been shown to improve ADHD symptoms significantly. So foods high in zinc, sunflower seeds. I had those this morning for breakfast. Pecans. I don't know if you have pecans here. Oh, you do. That's great. Yeah, those are a great healthy nut. They actually will lower your cholesterol as well, high P to S ratio. Sesame butter. What is sesame seed butter called? Tahini. But there's another ingredient that's present more in savory food that has sesame seed butter in it. What's that? Hummus. That's right. So I don't know if you guys are close enough to Lebanon to know what hummus is here. Okay. So, yes. Yes, half of it's chickpeas and the other half is sesame seed butter. That's how the Lebanese make it anyways, and it is, they know how to make hummus well. Cashews, a little higher. Pine nuts, a little higher yet. Wild rice is a great source. Notice pumpkin seeds showing up here again. I had those this morning for breakfast too. The person that served me breakfast put both sunflower seeds and pumpkin seeds together. And we put that on our quinoa this morning for a very healthy breakfast. And so zinc is something that we measure also in everyone that comes to the program. We also measure the copper levels, because I talked about copper often being too high. Zinc being just too low. We want to see these more evenly, and sometimes we need to actually use zinc supplements in order to benefit the patient, at least for a while, till they get their zinc levels up by diet. Magnesium is also a macro mineral that's been shown to increase brain serotonin levels. Studies have shown it can start improving depression and anxiety within 2 weeks. An interesting randomized controlled trial was done, 500 milligrams 4 times daily, or 248 milligrams of elemental magnesium per day, produced a significant clinical response. And it helps with methylation, meaning that we can actually make the neurotransmitters easier. And it can augment other neurotransmitters, including GABA, and that's why magnesium can also be a calming agent as well. And since it helps with methylation, it also helps with melatonin, because serotonin has to be methylated to make melatonin. So what foods are high in magnesium? You can see soy milk has some, whole grain will have it, even peanuts, okra, Brazil nuts. Your legumes are higher in it, but notice your greens are higher yet. Swiss chard, spinach, excellent sources of magnesium. And then omega-3. Omega-3 tends to be short in a lot of people in the world, and it's an essential fatty acid. It's involved in brain development, function, and aging. Dietary deficiency is associated with a higher risk of depression, bipolar disorder, schizophrenia, dementia, ADHD, and autism. You can't get omega-3 any other place than by consuming it by diet. It's not like it comes from the sun, like vitamin D or those sorts of things, or how you can make more melatonin through infrared from the sun. Omega-3 is present in other organs, but it's most abundant in the brain. And so this is something that's very important for our cognition. So benefits that have been shown to be associated with omega-3: improved sense of well-being, increased vigor and energy, improved reaction time, improved attention, reduces depressive symptoms, enhances cognitive function, better executive function, improved abstract thinking, increased resistance to depression, and it also can improve some of the aspects of ADHD, and it's been shown to actually increase the volume of your brain associated with memory. And it's also been shown to improve brain-derived neurotrophic factor, which is kind of a brain fertilizer. Now, if omega-3 could have been patented, it would be probably the most expensive antidepressant sold because it not only helps with depression, but it helps you with all these other areas. You won't find a pharmaceutical that's going to improve your frontal lobe function and executive function. You won't find a pharmaceutical that's going to improve your abstract thinking or even improve your reaction time, except if it improves it to the point where it's erroneous. You know, for instance, some stimulants can improve your reaction time, but they will also make you commit more errors. For instance, stimulants can make you type a little bit faster, but you'll make 10 times as many errors than if you're typing without those stimulants on board. And so omega-3 is one of those things that can improve your attention and reaction time without causing the adverse effects of the stimulants. In addition, it's been shown to improve memory in those with middle-age-related cognitive decline. So particularly the long-chain omega-3s. Now people think in order to eat those long-chain omega-3s, they have to get them from fish. But fish do not make omega-3 in their body. that means they have to get it from their diet. And where do the fish get it from? They get it from the plants of the waters. So plants of the waters, or even the algae, tends to be high in the long-chain omega-3s. And when we get it from fish, we're also getting it with mercury. And so that's why we want to get it. If we want to get it where the fish get it from, you're going to have mercury. You won't have to worry about the mercury. It lowers the risk of dementia. Among the elderly, it improves your ability to take care of daily duties. It'll cause larger brain volume. What we will see in CAT scans in individuals or MRIs is the older they get, the more their brains tend to shrink. But that's not natural. Our brains were not meant to shrink when we age. Our muscles were meant to shrink. We are going to have some changes that take place in muscles. I've noticed by aging all the way to 62, when I was younger, I could exercise and build up muscles quickly. Now I have to exercise just to maintain what I have. And that's just a normal part of aging. But our brains were not meant to deteriorate with age. And so there's other things causing them to deteriorate, not just the age. And if we're eating enough omega-3, our brains will stay large even when we age. So there's improved learning and memory. Beneficial effects on neurodegenerative disorders such as Alzheimer's disease and Parkinson's disease. It can protect us from these things. And it's even helpful for young infants. So mothers who breastfeed and get adequate amounts in their diet, their IQ of their babies is going to be 5 points higher than if they're drinking formula. Now the formulas, I don't know how it is in Zimbabwe, but the formulas in America don't allow omega-3 in the formula because the omega-3 comes from fish, and you don't want to be giving mercury to the infants. There's only one formula that now allows omega-3, and that's because they got the DHA from algae, from the plants of the waters. It doesn't have the mercury, but that's a more expensive formula. But if your mother is getting adequate amounts, and she's getting it from healthy sources, then that will help the IQ of your babies. And so a 5 point is a half of standard deviation, so that's a significant difference. So plant-based sources of omega-3. You don't need fish. There are plant sources. Notice blueberries are on that list. 1 cup has 86 milligrams of omega-3. Spinach is a good source, 166 milligrams. Pecans, we talked about, even better. Kale has almost double the amount that spinach has. Red bell pepper is a pretty loaded source of omega-3. Avocado, even double the red bell pepper. And then green soybeans, the edamame is higher yet. Wheat germ is going to be a great source of omega-3. Hemp seeds are number 4. English walnuts, number 3. Chia seeds, number 2. And the number 1 source of omega-3, higher than any fish that you'll consume, is flaxseed. And so in our program, we actually, if they're not sensitive to it, which the vast majority are not, we actually have them eat a tablespoon of flaxseed at each meal when they come. It's high in tryptophan, it's high in tyrosine, it has good balances of those things, and you're going to get your omega-3, a great source of omega-3. Now, we did have one person misunderstand that came to our program, and he was taking 3 tablespoons at every meal. If you take that much flaxseed, it's going to be a flaxative, meaning that it's so high in fiber that you're going to start having loose stools. And it can be a help for constipation. If you have constipation, you might try that. But he was having to get off the exercise trail and eliminate, and and he says, I think it's the flaxseed, and so that shouldn't do that. And he says, and then he told us how much he was taking, and so we backed him off on that, and he got better. Obesity is also makes depression more likely. Low energy levels. Obesity is associated with post spikes in blood sugar, after meal blood sugar spikes. That's why a lot of people feel sleepy after a meal. Getting on a weight loss program and losing more than 5 pounds can actually improve that right away. And so many people with obesity will talk about the improved energy even after they lose 5 or 10 pounds as a result of those postprandial blood sugars going down. So there's been a lot of diets studied in regards to depression. And, you know, the keto diet has been looked at, the Mediterranean diet, the paleo diet, the Atkins diet. But there's only one randomized controlled trial that shows improvement in depression in as little as 2 weeks, and it's a whole food, plant-based diet. Sometimes when people come to our program, they'll say, well, you know, why not the Mediterranean? Why not the keto? You know, there's all sorts of evidence for these diets. And they think I'm cherry picking, but you can't cherry pick when there's only one cherry. In other words, show me a randomized controlled trial that shows improvement in depression in any of those others. You won't find it. Now, the Mediterranean diet, you will find it, but that takes 3 months. 3 months before you show an improvement. And the Mediterranean diet is improving things because it's more plant-based than the typical diet by far. And it's using less saturated fat. And so, you know, cutting down on those things can definitely help over a course of 3 months. But people aren't well motivated to try to stay on a diet for 3 months when they're not feeling better even after a month of usage. And so we want to get them better quicker. And also the plant-based diet is actually a pretty easy diet to follow. One advantage over the Mediterranean diet is it has no arachidonic acid. Arachidonic acid is one of those things that's going to cause inflammation. There's no cholesterol, and so we don't have to worry about the oxidized cholesterol we talked about. It's naturally high in antioxidants, and it has better tryptophan and tyrosine uptake. We talked a little bit about this, but intermittent fasting can also be healthy. It reduces damaging oxidative stress in the brain and can promote production of new brain cells when we fasted for a total of 17 hours. It enhances BDNF production. Excess calories reduce synaptic plasticity. So when we are eating too much, our brain does not change readily for the positive. And so I think this is why even in antiquity, where you would see humanity change for the better was often after a fast. A fast actually helps the brain get ready for changing. So one of the things we'll do, we measure the people's BMI, we measure their metabolism when they come in, but we'll often, if it seems beneficial for them, we'll often fast them when they first come to the program. And sometimes they're wondering, you know, I paid all this money to come to this program for all this healthy, good food, and they're not feeding me anything. Just a water fast for maybe up to 36 hours, we might do that. That'll put them into ketosis, it'll increase their BDNF, their brain gets ready for positive changes, and when they start eating the good food, their brain starts getting better a lot quicker than if we would have not done that to begin with. And so intermittent fasting is helpful on a number of levels. Moderate caloric restriction can protect the brain by reducing oxidative damage as well. So we're not against ketogenesis if it's due to intermittent fasting. A lot of times people will talk about the advantages of a ketosis diet. And yes, you can have a ketosis diet that's meat, because you will go into ketosis if you're deficient in carbs. But we talked about the problem of being deficient in carbs. Carbs is one of the macro energy sources. It's actually healthy for us. It gets more tryptophan and tyrosine into the brain. So the exclusive meat eaters will notice some benefits because it will put them in ketosis. They won't be as hungry. They'll be able to have better weight control when they're on a carbohydrate deficient diet, but it's unsustainable. As I mentioned, you'll run into problems on a ketosis diet. So even the ketosis diet, they'll start adding carbs in order for them to be on it long term. So you've got to be on at least 20% carbs to be able to tolerate a ketosis diet for very long. And but you can also go into ketosis plant-based with lots of carbs if you are doing intermittent fasting, where you're eating breakfast and lunch but not supper. So ketogenesis initiates the removal or repair of damaged molecules, and the ketogenesis carries over into the non-fasting periods. The benefits: it improves glucose regulation, increases your resistance to stress, and it's also anti-inflammatory to fast. It improves mental and physical performance. This is one of the reasons why when you're sick, you don't want to eat. It's actually the body's mechanism of saying, don't eat. Now, I remember in the hospital when someone was sick, a couple of decades ago, the doctors and the nurses would be doing everything they could. You're sick. You need food. They'd say, I don't want food. And we would kind of force feed them, thinking that we were helping them. But we weren't helping them. They would have done better with their immune system, done better with their inflammation if you just let them not eat. Now, if they're not eating for a prolonged period of time, if up to 3 days, it's healthy. Once you go over 3 days, then it's not so healthy anymore if you're fighting disease and that sort of thing, unless it's a medically supervised fast. Now, we have a center in close to Weimar. It's called True North in Sacramento, and they're the #1 medically supervised fasting center in the entire world. People will go there just to not eat for maybe a month. And they're medically supervised fast. So you have to have a doctor helping you and measuring things and making sure that you're not causing permanent damage to yourself. But they can treat very resistant diseases. Yesterday I talked about how 80% of hypertension can be controlled with diet and lifestyle. Almost 100% will be able to be controlled by prolonged fasting. So if you're in that 20% where it doesn't help out, they have found out in True North that if you fast someone to the point where they're about a day away from dying, their blood pressure will fall to normal. It'll be high, 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 and then all of a sudden it's normal. And they said, watch out, as soon as it's normal, you better start feeding them, because they'll have about a day left and they'll actually die of starvation. Then you start feeding them and their hypertension does not come back. Their high blood pressure is solved. Those are for the very resistant, super high blood pressure readings. But interestingly, yes, when you fast, you'll get rid of muscle mass. You will get rid of a lot of things, muscle mass as well as fat. The fat will be taken away. But when you start eating again, the muscles will all come back. And the fat will not, unless you're eating excessively. And so that's one of the interesting aspects of these prolonged fast. We don't prolongly fast anybody at Weimar because we haven't seen the need to do that sort of thing. I think if you're a more unhealthy eater, to go through maybe a month of fasting every once in a while would be good for you. But if you're a healthy eater, it's rare that you're going to need to fast for more than 3 days. So most people that fast 17 hours, they're fasting by eating lunch and supper, but not breakfast. There's complications associated with skipping breakfast. Studies show you have more depression. It decreases your mood. You become lonelier. You'll also have more sleep problems. And this has been well shown. Your academics will go down when you're not eating a good breakfast. Risky behaviors also increase as a result of skipping breakfast, like utilizing drugs and that sort of thing. When we eat a good, healthy breakfast, studies show lower levels of depression and stress, better cognitive performance, better scholastic scores, and improved creativity. This is the frontal lobe enhancing from this. And then one other thing that we should mention is folate and B12 deficiency. We see this pretty common. And when B12 and folate are reduced, you're going to have reduced S-adenosylmethionine. And for those of you that took biochemistry, you're going to recognize neurotransmitters are going to go down when you don't have enough of that. Correction of folate and B12 deficiencies may alleviate depressive symptoms and augment the response to antidepressant therapy, perhaps because of the resultant increase in SAMe concentrations. So in concluding this section, we'll have a break after this. This is a review article that was done in a prestigious European psychiatric journal just a few years ago, where they went through all of the advantages of nutrition and healing many mental health conditions. And they said this: now is the time for the recognition of the importance of nutrition and nutrient supplementation in psychiatry. They go on to say this: nutritional medicine should now be considered as a mainstream element of psychiatric practice. And I mentioned yesterday, mainstream actually should be diet and lifestyle for mental health disorders. The medication should be considered alternative medicine, or maybe the complementary, because the evidence for nutrition and lifestyle in regards to helping mental health is now overwhelming. And so if your psychiatrist is not talking to you about what you're eating, is not trying to correct some deficiencies that you might have, or maybe excesses, taking some things away, he's not a mainstream psychiatrist. He's an old school psychiatrist, and he hasn't caught up with the scientific literature. So any questions about this section before we break? All right, I don't know if we have a roving microphone today, but if not, we could just, I think they're going to get a microphone in the back. We have someone here in the front, and then we have someone here a few rows back.
Thank you, Doc. Maybe culturally, if our patient, if someone who is not feeling well is failing to eat, it becomes a cause for concern. And probably deterioration will be noticed hourly. And we were once told that food becomes the first line of medicine or recovery before we could even administer some paracetamol and whatever. And I hear you, if I hear you well, you said, don't force them to eat. Let the system generate its own energy and so on. Please convince us again.
All right, there was a question back here. Thank you for that comment.
There have been studies which have been done like at a psychiatric institution. Like patients, sometimes they tend to stay long, like 3, 4, 5, 6 months. of the effect of nutrition, exercise, water, all these other treatments that we were talking about yesterday, that if they are instituted at a psychiatric hospital, that it helps. Have there been such studies? Like patients who are admitted at a psychiatric hospital, we give them a plant-based diet, sunlight, water, therapy, everything.
Yes, and this underscores the need for inpatient psychiatry to be transformed. You know, one of the things that we've noticed for those who have been in an inpatient psych institution, many of them would rather die than to go there. And they can be depressing places. You don't see the sun. The diet's not healthy. They're just administering medicines. And they do some things well, like they take your phone away from you. And, you know, they take their technology away from you. And, you know, they might be some therapists there that work there that are fairly good therapists that can help them rationalize better. But in general, it's a very disturbing place to be in. And one of our goals, in America, psychiatric hospitals are not run well either. And I'll tell you a brief story. Maybe it's going to be a little bit too long, but there was a nurse anesthetist. In America, nurse anesthetists make good money. They make more money than the average doctor. And there was 2 nurse anesthetists. One of them was the president of the association. They had high income. They couldn't have children, however, but the nurse anesthetist, who was the female, had a sister who had 7 children, all out of wedlock. She was she was addicted to gambling. And she had 7 kids in a van, and one of them called up this nurse anesthetist and said, "Can you adopt us? We're not being taken care of. Mom's in the casino, and we're all out here, and we're arguing and all this, and we know we need someone who can be a mommy and a daddy to us." And they thought they might get that call, and they said, "If your mother allows us to adopt all of you, we will adopt you." The mother actually agreed. 30 days later, they inherit 7 children between the ages of 2 and 16. And they all have serious mental health issues. You can imagine being raised in an environment like that, by definition, neglect. You know, we talked about all of and there's even abuse and all of those sorts of things. So they started to have them need the mental health system. And they noticed the mental health system was to capacity, and they try to find out who was good. If they were a good mental health provider, you had to wait a year to get in. And so mental health was done by primary care doctors because the specialists were all filled up. And even if you did get someone who was good, it wasn't that good. And so he decided that he was going to become a mental health provider himself. He had his doctorate in nurse anesthesia, but then he got his doctorate in psychiatric nurse practitioner. And he came to our residential program, and he found out how things can actually be run in psychiatry. And he started to put some of those principles. He couldn't do it comprehensively, but he tried to put some of those principles to practice in an outpatient clinic setting in the state that he lives in, which is Arkansas. That was 5 years ago. And now 40% of all the mental health patients in the entire state are seen by his clinics. They've expanded everywhere because all of a sudden people are actually getting some benefit for their mental health care. And they're not just chronically being subdued with medicines. his kids that have grown up, they all have jobs, independent now. And they at Weimar. And we'll see how he goes with it, but I think since he's done so much in the outpatient clinic setting, he might revolutionize the way inpatient psychiatry is done. But it's utilizing these same principles. And so it's just underscoring that our mental health system is not where it should be in the world today. And mental illness is dramatically increasing. It's not decreasing despite our mental health services. And if we're doing mental health the right way, we should start to actually decrease it and not increase it. All right, question here.
Thank you, Doctor. I want to ask about the seeds, the flax seeds, and the sesame seeds, the other seeds we take. Do we do something? Do we roast them? Do we soak them? How do we do?
Okay, yeah, great question. So to get the nutrients out of the seeds, it's best to actually grind them, particularly, the flax seed. If you're just eating flax, it's a good fiber, but you're not getting the nutrients. Those membranes don't break down very well. And so it just takes a little coffee grinder, 5 seconds or less. You put it in there, zoom, and you have got the nutrients now. So we recommend the ground flax. And there are some seeds, like pumpkin seeds, that you can get more nutrients out of by chewing. But you actually get more by roasting the pumpkin seeds. Even the flax seed, you get a little more by roasting them as well. So we recommend for nutrient value that you roast and grind to get all the nutrients. If you're trying to feed your microbiome, then you might want to eat more raw, etc. So it's good to have some of both, actually. All right, and there's one more, maybe two more questions, and then we'll break. Let's see, where'd the microphone go?
Okay.
Okay, good.
All right. When we look at the Jewish community, the rabbis are very motivated to talk about kosher, to talk about what they would say kashrut, talking about food that the Jewish people are supposed to eat or not supposed to eat. When we look at the Muslim community, the imams, which are also equivalent to the rabbis or the teachers, they are also prominent, or they advocate talking about foods that they are supposed to eat, which they will call, foods which they are not supposed to eat, which they will call or say it's haram, or things that they would advocate to say, this type of food, I think here in Zimbabwe, we have seen packages branded halal to say that it has been prepared in a way such that Muslims can eat. So now bringing it home, when it comes to the Christian community, there seems to be diverging views, particularly bringing it closer in the Advent faith. I then have a question. Let's say I've invited someone who's not yet Adventist to our church circles, and for us youths, we tend to have social Sundays, and after we then go maybe for braais and what you would call barbecue. The challenge that then comes is when they hear messages about health talk being presented, it seems as if, or it's known that Adventists, they advocate for a plant-based diet. Then why is it then we accommodate meat diets and the likes? Is it that we are saying it's okay to have clean foods from Leviticus chapter 11, at the same time also saying let's move away from those clean foods? I don't know if you get me clearly, because it seems it's creating sort of like some diverging views, with a certain group moving on the extremist sides that even says, if you continue to eat meat, you might even fail to attain heaven. So how can we marry the two groups, those that advocate for a clean diet based on Leviticus 11, and those that are saying let's totally move away from meat the sciences are proving that when you eat, from the presentations you have done yesterday, we have seen that the science is telling us that a meat-oriented diet has challenges that are not beneficial to us as believers. Thank you.
Yes, so maybe I'll answer that by taking a little bit of a 30,000-foot view. In fact, some people wonder why clean versus unclean meats. You know, as I mentioned, chicken, if you don't scrape the fat and the skin off, it has more cholesterol than pork. And so, you know, why this distinction? The distinction is actually due to infectious diseases. Every pandemic that we know that started in this world started from eating unclean meat. Or maybe in the case of AIDS, we know AIDS started in the Congo, HIV. It's very clear where it started from. It's even clear the valley it started from, etc. But it was either from eating chimpanzee or it was having sex with chimpanzee, something that the Bible forbids on either account. And the flu pandemics started with eating swine. So, and also the Ebola pandemic, bats, the SARS pandemic. The first SARS was civet cats. And this last one, they have not been able to elucidate, but they know it started in what city, and they know that it started, it looks like at that wet market, and it looks like it came from pangolin, which is also an unclean meat. MERS, Middle Eastern Respiratory Syndrome, started from camel, also unclean. So you might die from a disease that you eat a clean meat from, but you're not going to readily spread that to the rest of humanity. But if you are eating unclean meat and you get an infection from unclean meat, that can be spread rapidly from person to person who never ate the meat. And so I was on the plane with a member of the World Health Organization, infectious disease, during the COVID pandemic. We got to know each other. I didn't know him. He didn't know me. And I said, why doesn't the WHO come out with a worldwide policy that they recommend everybody stay away from unclean meats, because we will not have another pandemic on this earth and all of the issues. He at first said, well, I think some pandemics, no, and then he backed himself up. He says, you're right. Every pandemic came from unclean meat. I said, so why doesn't the World Health Organization say the obvious? And he kind of smiled at me and he said, if that happened, people would get the idea that the Bible is a health book. The Bible is a health book. It's probably a better health book than a lot of the thick textbooks that they've come up with. But because of the prejudice against the Bible and religion, experts are allowing the next pandemic. They'll put austere measures in that you can't travel, you've got to get vaccinated, you've got to get this, you've got to get that. They can put in all sorts of austere measures after the pandemic occurs. But it wouldn't be that hard to do that. Now you say, well, some people might still eat unclean meat. It could still happen. Well, you know, we have laws in California, we have laws against arsonery. Arsonery is starting a fire. In the dry season in California, there's so many trees there, you start a fire and it can wipe out homes, it can wipe out lives, it can be very major. And you can go life in prison if you start a fire. But does that mean we don't put a law in because someone is still going to start a fire anyways? No, it does deter them significantly to have those laws and to not light fires. We have laws against murder. People still murder. It doesn't mean we shouldn't have the law. But if we just educated the public on what would happen and then actually enforce it, so when you can go back, even in regards to Ebola, in regards to the original SARS, you could go back to the very person who ate the unclean meat and started the whole worldwide pandemic. If there was a law in place, you could actually penalize that person. Put them in jail for a while. Say, you know all the problems you caused because you decided to eat outside of what is healthy for humanity. So unclean meat, eating of unclean meat is not compassionate to the rest of society when we understand those things. And so if we want to be the most responsible citizen, if we are going to eat meat, it should be clean meat. But we also don't eat meat the way the Jews ate meat. They got rid of all the fat. It was not, they also got rid of all the blood. It wasn't very tasty. It was like leather. But if they needed some protein, they could do that. But every Jewish citizen recognized that plants were the healthiest. And of course, when you go back to Genesis, the original diet of mankind was not meat. It was after the flood that was added, and notice what happened to the life expectancy that occurred afterwards. And so we can press towards a healthier way of eating. Daniel also clearly was plant-based. And so, and we know what happened to him in regards to longevity and mental health and physical health. So it's not a test of fellowship in the Adventist church to be plant-based or to be vegetarian. I don't think it ever should be a test of fellowship. But it should be a principle for every Christian to be as healthy as we all possibly can be. And so some of us are not prepared to move that direction right away. But it should be a direction that all of us are doing, is learning about how we can best take care of our body and what best to put in it. And let's decide that whatever we eat, whatever we drink, do all to the glory of God. And that's one of the reasons why one of the founders of our church mentioned that every potluck that we have should be vegetarian. Why? It's not to force anybody on anything, but to have one meal be an educational meal. That you can actually eat healthy and it be tasty. And if they like that in the potluck, they might actually decide to cook some of those dishes themselves when they get home and start utilizing it that way. Does that make sense? All right, thank you. And we've got another question back there, yes.
All right. My question is on the fast. So, what is the best, what is the best time of having the fast, or the period of having the fast? Let's say if one wants to get into maybe a juice fast, what would you recommend the period that the person should get the fast for the juices? Then also, how do you deal with the issue where someone has been on fast and is at the point of getting starved, that his blood sugars are getting low, maybe in a setup where we don't have access to intravenous fluids? So how best can we handle it? Especially with the people who are not able to eat anything or to get enough juices. How can we handle that in relation to the fast?
So yeah, as far as water fasts, I already answered that. Shouldn't be over 3 days unless medically supervised. But as far as like a juice fast, it depends on how many calories and what is in that juice, etc. But in general, a juice fast can go for longer. You know, if the juice fast is just cucumbers and a few vegetables that you're putting in there, and you know, maybe a fruit or something or an apple, You can do a 600 calorie juice fast for maybe a couple of weeks and still it can be, healthy. But it really is dependent upon what is in that juice as to how far you can go. And as far as, if you get into symptoms of dehydration or things like that, we do have a lot of glucose stored in our body's liver. And so that liver can produce glucose for a prolonged period of time, even weeks if necessary. And so, you do have finger stick machines where you can check your blood sugar. But as long as it's greater than 50 or 55, it's not really a problem. If it starts dropping below that, then the person really needs to do something to be able to get that glucose up. But that's probably enough said in regards to all of that without getting into specifics. All right, and then we have one more final question here.
Dr. Nedley, concerning the treatment of depression, including also bipolar and so on, how do we manage the omega-3s, or what would be the recommended amount of the flaxseed in treating somebody with depression and plus bipolar? That's my first question.
Okay. So with depression, the studies have shown 3 grams of omega-3 can make a pretty big difference, 3,000 milligrams. With bipolar, 9,000. So you need 3 times the amount of omega-3 to help with bipolar and for mania. And so, yeah, we will dose it depending upon the diagnosis.
Okay, my second question is tubal ligation and in relation to hormonal imbalances. What is your take on, or is there any significant relationship to hormonal imbalance and tubal ligation?
I have not heard of any significant association there. I know there's a lot of tubal ligations that are done throughout the country, and we measure ammonia levels in a lot of individuals as well. Ammonia level is primarily regarding the liver, and the tubal ligation should not decrease your liver function significantly. So yeah, if you know anything more about that, I'd be interested, but I haven't seen a problem there. All right, well, you've been a very attentive group, and let's see, it's 11:54 right now, so let's take 15 minutes. We'll be back at 12, let's make it 12:10. Let's try to be back by 12:09, and we'll start at 12:10 so we can finish up by 1 o'clock for lunch. Thank you. picture?
A quick one before you start.
I don't know whether you want to come down or come up. Thank you. It's coming down. All right. Okay. Thank you. Don't take one. Take as many as you can. Another.
Wanted you to understand, we talked about yesterday using devices smartly, but I wanted to show you some of the research. The idea that thoughts and feelings are only sequestered in our skulls is obviously false. We now know that our thoughts and feelings can be skewed by external forces we're not even aware of. And that's because the brain is a monitoring system as well as a thinking system. It's a what? Monitoring system. That means its attention is drawn toward any object that is new, intriguing, or otherwise striking. Media and communication devices, from telephones to TV sets, have always tapped into this instinct. And whether turned on or switched off, they promise an unending supply of information and experiences. By design, they grab and hold our attention in ways natural objects never could. And you know, I didn't quite understand how powerful this was until a number of years ago. This was after the smartphone came out. It was probably 2009. I'm a pilot. And I was doing a camp meeting in Arizona, and I had to go to a certain place that day to in an airport north of the Grand Canyon to get my aircraft worked on. And one of the other speakers at the camp meeting knew I was going to be flying over the Grand Canyon and wanted to be able to see it with his son. And so we let the son in the back, and me and him were in the front, and we're flying over the Grand Canyon, and as we're flying over, we're taking some turns and seeing this beautiful sight from the sky. And he looked back on his son, and he said, son, you know, we're over the Grand Canyon. Why aren't you looking out the window? And he said, I've already seen it. Guess what he was looking at? He was looking at his phone, not over the Grand Canyon. And he said, son, we've actually never been here. And he said, Well, I saw it in pictures as he's still interacting with his phone. And so this media device can grab and hold our attention in ways natural objects never could. Out of all media devices, the smartphone stands out because the phone is packed with so many forms of information and so many useful and entertaining functions. It acts as what Dr. Ward calls a supernormal stimulus, one that can hijack attention whenever it is part of our surroundings, which, since we carry it in our pockets and in our purses, it always is part of our surroundings. So imagine combining a mailbox, a newspaper, a TV, a radio, a photo album, a public library, and a boisterous party attended by everyone you know, then compressing them all into a single small radiant object. That's what a smartphone represents to us, and it's no wonder we can't take our minds off it. 2015 Gallup survey, more than half of iPhone owners at that time said they couldn't imagine life without the device. They'd only been out 8 years, but they couldn't imagine life without it. It's hard to imagine another product that has provided so many useful functions in such a handy form. But while our phones offer convenience and diversion, they also breed anxiety. Their extraordinary usefulness gives them an unprecedented hold on our attention and a vast influence over our thinking and behavior. So what happens to our minds when we allow a single tool such dominion over our perception and cognition? Studies clearly show as the brain grows dependent on technology, what weakens? The intellect weakens. Using a smartphone, or even hearing one ring or vibrate, produces what? Distractions that makes it harder to concentrate on a difficult problem or job. The division of attention impedes reasoning and performance. When people's phones beep or buzz while they're in the middle of a challenging task, their focus wavers, their work gets sloppier, whether they check the phone or even if they don't check the phone. When people hear their phone ring but are unable to answer it, their blood pressure spikes, their pulse quickens, and their problem-solving skills decline. A study was done at UCSD, University of California, San Diego, of 520 undergraduate students. They were given 2 standard tests of intellectual acuity. One test gauged available cognitive capacity, a measure of how fully a person's mind can focus on a particular task. The second assessed fluid intelligence. That's also known as IQ, which is a person's ability to interpret and solve an unfamiliar problem. The only variable in the experiment was the location of the subject's smartphone. Some of the students were asked to place their phones in front of them on their desks. Others were told to stow their phones in their pockets or handbags. Still others were required to leave their phones in a different room altogether. The results were striking. In both tests, the subjects whose phones were in view posted the worst scores, while those who left their phones in a different room did the best. The students who kept their phones in their pockets or bags came out in the middle, and the study's author said, as the phone's proximity increased, brain power decreased. But interestingly, they asked these students afterwards, did the phone have any bearing on your scores? Nearly all the participants said their phones had not been a distraction, that they hadn't even thought about the devices during the experiment, so it couldn't have had anything to do with it. They remained oblivious even as their phones disrupted their focus and thinking. So people tend to minimize the effects of what this actually has, and it actually takes studies to actually help them to realize these were striking results. It had to have an influence. A second experiment conducted by the researchers produced similar results, while also revealing that the more heavily students relied on their phones in their everyday lives, the greater the cognitive penalty they suffered. Our attachment to our phones has grown so intense that their mere presence diminishes intelligence. Dr. Ward and his colleagues wrote that the integration of smartphones into daily life appears to cause a brain drain that can diminish such vital mental skills as learning, logical reasoning, abstract thought, problem solving, and creativity. Could you imagine a drug that was released on society that had adverse effects in all of those areas in order to get one positive effect? Even the FDA would not allow the drug to be released. But when it's a smartphone, then it's all allowed despite all of the adverse effects. Another study, people had their phones in view, albeit turned off, during 2 demanding tests of attention and cognition, made significantly more errors than in a control group whose phones remained out of sight. The 2 groups performed about the same on a set of easier tests. Researchers examined how smartphones affected learning in a lecture class with 160 students at the University of Arkansas at Monticello. They found that students who didn't bring their phones to the classroom scored a full letter grade higher on a test of the material presented than those who brought their phones. It didn't matter whether the students who had their phones used them or not. All of them scored equally poorly just by having their phones with them. Study of 91 secondary schools in the UK, published in the journal Labor Economics, found that when schools ban smartphones, students' examination scores go up a little bit, go up substantially, with the weakest students benefiting the most. So using devices normally, quote, significantly reduces your brain's capacity to process information. According to a study from University of London, multitasking actually reduces your IQ, with multitasking men dropping an average of 15 points, effectively giving them the same cognitive capabilities as an 8-year-old child. We wonder why some men act like 8-year-olds? This can be the reason. Researchers at the University of Sussex in the UK compared the amount of time people spent on multiple devices, such as texting while watching TV, to MRI scans of their brains. They found that these device users had less brain density in the anterior cingulate cortex, a region responsible for what? Empathy, as well as cognitive, and what other type of control? Emotional control. In order to manage distressing emotions, we have to have this anterior cingulate gyrus. And I told you it wasn't intuitive when these phones came out. I didn't think they would be as dangerous as they were. But let me just tell you about what the studies show, because today people are told, even in high school and college, here's your assignment, go online and accomplish your assignment. So they'll go online to start doing their homework. Studies show within 3 minutes, they're no longer doing their homework. Why do you think they're no longer doing their homework? They got distracted. So they get online to do something useful, and then a push notification comes through. Donald Trump just got handcuffed and put in a New York City jail. Oh, wow. I have to see the look on his face when this is happening. And I have to see what the right says about it. And I have to see what the left says about it. So that takes them about 15 or 20 minutes. And then as that's closing, then they get a Snapchat from the friend on iMessage. If they don't look at that picture, they're going to lose it and never see it. So they have to look at the picture. And as they're looking at that picture, then the engineers who know what this kid likes starts floating a BMW automobile made in Germany across the screen. And the kid, and it says, this A15 is now at your local BMW dealer. Oh, I knew this new BMW was coming out, but I didn't know it was coming out so quickly. Let me just click on that and see what's different about that automobile. And so they're looking at what's different about the automobile. By this time now, another text comes in from a friend that they answer. 45 minutes have gone by, and now they're thinking, why did I get on this device to begin with? Oh, yeah, my homework. So this division of attention actually shrinks down the anterior cingulate gyrus of the brain. It was actually better for that kid to be gardening for hours, focusing on weeding a garden with no device there, that anterior cingulate gyrus would build up to be able to focus, and that person would actually become more intelligent just doing gardening as far as intelligent capacity than trying to do his homework on a device that distracts. And so what happened is people's attention spans have gone down. I don't know if you've noticed, but even if that kid was able to choose a YouTube video, a 50-minute YouTube video of the engineer describing the new engineering features of the BMW, he would not look at it. 50 minutes? I'm not going to be able to stay focused for that long. Where's the 2-minute version? And because they can't focus for that length of time, they're not going to be able to manage distressing emotions. And so this is why emotional disorders have skyrocketed in every country once these smartphones come out. So if we were to teach you how to use a smartphone before you got them, it would be like this. Don't allow push notifications, turn that all off. Don't allow even text messages to interrupt what you're doing on your phone. Don't allow email notifications. Be focused on what you're doing usefully and then get done with it and put it down. And actually, before you get on there, give a time limit in regards to how long are you going to take to be able to do this task. And do your best to get it done in that time limit and then put it away. That way you can stay focused. That way you don't have the cognitive penalty. Your anterior cingulate gyrus stays strong, and you're going to be able to manage distressing emotions that come your way. In a study conducted at the University of Essex in the UK, 142 participants were divided into pairs and asked to converse in private for 10 minutes. Half talked with a phone in their room, while half had no phone present. The subjects were then given tests of affinity, trust, and empathy. The mere presence of mobile phones inhibited the development of interpersonal closeness and trust, diminished the extent to which individuals felt empathy and understanding from their partners, and the downsides were strongest when a personally meaningful topic was being discussed. This is one of several reasons why when people come to our program, their phones are taken away from them. We want to have that affinity. We want to have that empathy. We want to have that personal trust. We want to have meaningful things discussed. And I can tell you what will go on if they have a phone and they have distractions. It'll be the end of the program, and then they'll realize I never touched on the most meaningful topic here. And then the very last day, they might tell us something meaningful that we can't even work with them on because they had their phones and they didn't get to the depth of it. And so if you really want to learn, and of course they only have 10 days to be able to learn, they're going to be able to learn far better without their phones. Now we give them their phones for a half hour a day to keep up with their family, etc. As long as they don't violate that half hour, we'll have 17 and 18-year-olds that they'll have that phone for a half hour and then they're not giving it back. And when we get it back, they don't get their phone the next day. They have to be responsible with it, etc. But how long does it take for the anterior cingulate gyrus to start to grow? You know, within 10 days, we'll see a marked difference just taking their phone away from them. They will develop interpersonal closeness and trust. Often they develop more interpersonal closeness and trust in 10 days with everyone who hasn't had their phone than they have with their family back home. Why are they closer to these people than their family? Because their family all has phones too. And if the parents are on their devices, the kids are going to be on their devices even more. And the average 18-year-old is going to learn far more from their device than from their parents. In fact, they will trust their device more than their parents. And you know, you can understand it a little bit because if they might ask their parent what the population of Zimbabwe is, and the parent might not know what the population is, but if they ask Siri, they'll get an answer right away. And so Siri can answer these questions very quickly. And so they start thinking, my mom and dad isn't smart, but this device is very smart. And then, if this, 13-year-old girl starts deciding that she likes to play soccer and she likes to play basketball, and she puts into Siri, I like soccer and I like basketball, then Siri then types back, then you might be a man and not a woman. Do you really know what your gender is? Check here to find out. And Siri is smart, smarter than parents. And so when the girl decides at 13 that she's actually a boy and informs her parents of that, and then she goes to a counselor and tells the counselor that, and I can tell you what the typical advice will be of a counselor that is trained at our universities run by Jesuits and run by atheists. It's going to be, if you're thinking you're a boy now, then you just better plan on transitioning right away. So you're only 13, let's put the hormone blockers on, let's put this on, and let's put that on. And so, and what do you think happens to their mental health now? And they think their mental health problem is because of their parent not understanding that they're actually a boy. And so if my parents would just affirm me that I am a boy, then I would feel better. So they go through the transition, they go through the surgery, they go through the hormones, and studies show their suicide rates are off the charts within 10 years. They feel better for a year or two because they got their way, but then they realize what they've done to themselves. And they realize, I'm never going to be able to have a baby. I'm never going to be able to menstruate again. I'm never going to be able to do any of these female things. And I actually realize I kind of was a female, wasn't I? But I kind of changed myself. Now how can I detransition? Can I become a female again? And there's no support group to turn them into a female. The support is all there if you want to transition the other way. If you want to detransition, you're not there. And what started it all? Their mobile phone that they trusted to be smarter than their parents and smarter than the loved ones in their life. What about memory? People's knowledge and understanding may actually dwindle as gadgets grant them easier access to online data stores. Memory experts had a group of volunteers read 40 brief factual statements. Half the people were told that the machine would save what they typed. Half were told that the statements would be immediately erased. Now, speaking about memory, studies show you'll do far better in memory when you're learning something to actually write it down with pen and paper than typing it in. Some people say, well, then I'm not going to be able to save it. Yes, you can. Just take a picture of what you wrote, and it'll be saved in your device or your computer. But these people were typing it in because they were wanting to remember it, and half were told that it'll be saved in the computer. They thought it would be saved. The other half were saying, well, you can type it in, but it's not going to be saved. Afterward, the researchers asked the subjects to write down as many of the statements as they could remember. Those who believed that the facts had been recorded in the computer demonstrated much weaker recall than those who assumed the facts wouldn't be stored. Anticipating that the information would be readily available in digital form seemed to reduce the mental effort that people made to remember it. The researchers dubbed this phenomena the Google effect. Because search engines are continually available to us, we may often be in a state of not feeling we need to encode the information internally. When we need it, what do we think? We'll just look it up. But as a result, people don't have factual things stored in their brain. And when you don't have factual things stored in your brain, you can be told some pretty irrational stuff, and you're gullible, and you'll believe it. Because your brain is not stocked with truthful facts. Also, the art of remembering is the art of thinking. Now, at Weimar University, we're a small university, and one of the hardest schools to get into in America is medical school. For instance, last year, my youngest son just got admitted to the first year of medical school. 172 people in his class, and 5,500 people applied to get in. Only 172 got in. So at Weimar, the typical university where you have to go to pre-med, undergraduate college to get into medical school. So the typical undergraduate university, if they're really training people to get into medical school, studies show it'll be a less than 30% chance that that student that takes pre-med and applies will actually get in to medical school. At Weimar University, we have a pre-med program, and we're at 94%. Why so much higher than the other universities? What happens when our chemistry teacher, and she teaches general chem, organic chem, and biochem. She's an expert chemist, and normally chemistry people specialize in one of those areas, but not necessarily all three. She will teach a biblical concept along with the chemical concept. Now you think, well, that's too much to learn. Why don't they just learn the chemical concept? Well, in the MCAT is the test that you take. It's medical college admission test. So that's what you have to do well on to get into medical school. In the MCAT, they're always coming up with new questions that you've never seen before, but that are solvable if you know your chemistry well. So they will be taking this test, and they'll see the question, and they'll say, I've never seen that before. They look at the area that's covering, and guess what they'll think of first? The biblical concept. Then they'll remember the parallel chemistry concept, and then they'll solve the equation. Our students, some of them have been known to not miss a single question on that medical college admission test because they have learned two things, not just one thing. And the art of remembering is the art of what? Thinking. And so because they've remembered those two things, their mind is stocked with all sorts of facts, and they can think outside the box, and they can solve unfamiliar problems. Only by encoding information in our biological memory can we weave the rich intellectual associations that form the essence of personal knowledge and give rise to critical and conceptual thinking. No matter how much memory swirls around us, the less well-stocked our memory, the less we have to think of. When people call up information through their devices, they often end up suffering from delusions of intelligence. The advent of the information age seems to have created a generation of people who feel they know more than ever before, the scholars concluded, even though they may know even less about the world around them. So they're proud because they think they know a lot. They've got this device, but they actually know a lot less. So there was a major survey looking at the lives of over 1 million young people in the United States, and they found out teens who spend large amounts of time glued to phone and computer screens are markedly less happy or more happy. Less happy than those who prefer what? Real-world activities and interactions. Using social media, texting, video chatting, multi-platform video games, all associated with what? Less happiness. But you take the device away from the teenager, and they think for sure that you're against their happiness. And they don't understand. Yes, short term, they've gotten addicted at this point. And the addiction can be powerful. Let me show you how powerful the addiction can be. The other day, I had to go to the emergency room and see a 15-year-old who was seriously injured. Why was she seriously injured? She jumped out of a moving vehicle down the highway. Why did she jump out of a moving vehicle? because her mother reached over and took away her smartphone. Now, she was doing some bad things on that smartphone, and the mom found out about it, and she took it away and said, "You are not getting this back for a long time." And when daughter, who was addicted, realized her phone was gone for a while, life wasn't worth living anymore. And so I might as well just jump out of this moving vehicle and end my life. Is that an addiction? That's a powerful addiction. And these things are as addictive or even more addictive than alcohol. And they also suppress the frontal lobe, not quite the same way that alcohol does, but they still suppress the frontal lobe in regards to the area of empathy and managing distressing emotions. And because she was addicted, she didn't have that anterior cingulate gyrus to manage the distressing emotion of her mother taking that away. And so that whole phone addiction set her up for that issue. And so when you take the phone away, they think you're against their happiness, despite the fact that studies show if they don't have that phone, they're going to become happier. And you know, that'll happen. In our program, we have a lot of people addicted to their smartphones. Not just kids, adults, even the elderly. We had a 70-year-old man who thought he would outsmart us. We took away his device, but he had another hidden device. And the first lecture we give when people come to our program is portions of this lecture to tell them about technology, because the first thing we're going to do is take away their phones. We let them use them until this first lecture so they know why we're taking them away. He says, "Well, what am I going to do about my stocks?" He said, "I need to see what my stocks are doing." Stocks. He said, "I need to see what my stocks are doing." So, you know, they have all of these reasons, etc. But what happens when they give it up completely? In 10 days, I mean, when this program ends, there's almost a euphoric high in the room in regards to how everyone has been transformed. And we have to remind them as we give this phone back to them, you got better without this thing. You got better without this thing. And now you need to be able to use it smartly, because they can go back into it again and get into those addictions as well. So all of these things we think are helping our happiness, they're all associated with less happiness. Youth who invested more time in non-screen activities, even playing sports, reading newspapers, instead of reading off of devices. What type of social interaction? Face-to-face social interaction. By the way, social media has been shown to make us antisocial. And the people that are into social media, they'll also have social appearance anxiety. Have you heard of social appearance anxiety? Social appearance anxiety is when you don't want to appear in front of people live because you know that your appearance is going to be judged negatively by others. Why are you so confident of that? Because you've seen beautiful pictures on other female Instagram accounts, and you're not as beautiful as they are. Now, what you don't realize is they took 1,000 pictures of themselves with different lighting until they found a picture that looked least like them, and then they posted it up there for everyone else to be envy of. And the other friend is thinking, I'll never be able to look like her, and they don't realize she doesn't even look like her on that Instagram account. And so social appearance anxiety is at an all-time high, and people with negative views of their appearance. But notice, when you were into real face-to-face social interaction, we're significantly happier. Life satisfaction, self-worth, and happiness of young people in the U.S. plummeted after 2012, the year when the proportion of Americans owning a smartphone rose by over 50%. Happiest teenagers are those, and now they know this is true for adults as well. Happiest people are those who use digital media less than what? 1 hour per day. After a daily hour of screen time, levels of unhappiness rise steadily. Now, the big question I get is, what if we have to use this for work? I have to use it for work as well. There's an electronic health record, and I have to use it for work. But I do not allow push notifications. If Donald Trump gets handcuffed and put in a New York City jail, I do not get a notification of that in the middle of a patient visit. Would that be fair to the patient that I'm seeing? No, because my mind would then be distracted off of them, that I really need to learn everything about them in order to get better. I don't have push notifications come through. I don't have, text notifications, email notifications. Now, some people say, you're president of the university. What about if your faculty needs to get in touch with you? Well, they can text me, but they know I may not see that text for a long time. They can email me. They know I do my emails every day, but sometimes I do them in the morning one day and in the evening the next. So it might be 40 hours before I do the email. What if they really need to get in touch with me? They have legs. They have face-to-face. They can actually come and they can figure out very quickly where I'm at. And they can stand outside that door so that when I get out of there, they can see me. And they've done that. If they really do need to see me, then they can put some effort into it. And then I will focus in on what they're doing. But we need to recognize text messaging came about so that we could answer it back at our convenience. This idea that we need to answer a text message immediately, or otherwise we're not responsible, will set us up for mental health issues. So the key to digital media use and happiness is limited use and intelligent use. High-speed media content contributes to attention deficit as well as decreased concentration and memory due to the brain pruning neuronal tracts of the frontal cortex. If you're never paying attention to anything for more than an hour, really focused attention, this area of your brain says, you don't need me anymore. You don't pay attention for long periods of time, and so it starts dismantling the anterior cingulate gyrus. And that's why we see the difference in the MRI scan. We can see that shrunken area of the person who is hooked to their device. Now, the good news is it can come back, but it takes 6 weeks. 10 days in our program, if they're addicted to their device, we're going to tell them a 6-week electronic fast, and then use it intelligently. There's a child and adolescent psychiatrist in Los Angeles. She's very famous. She wrote a book called Reset Your Brain, and it's all about technology. And she says she won't diagnose any mental disorder in anyone until they give up their devices for 6 weeks. And she says often the mental disorder completely resolves at the end of 6 weeks. Now, if they're in school, she'll have to write, this student is disabled and cannot learn by devices. You need to use real books. You need to give them paper tests. You need to give them that. And the school has to follow that doctor's order. So children and adults who can't pay attention can't what? Can't even learn. Here's the name of the book, Reset. She wrote it, Your Child's Brain. End meltdowns, raise grades, boost social skills by reversing the effects of electronic screen time. So this is Daniel Goleman. He's the author of the book called Emotional Intelligence that set that phrase as a popular phrase. He says the circuitry for paying attention is identical for the circuits for managing distressing emotions. The attentional circuitry needs to have the experience of sustained episodes of concentration, reading the text, understanding and listening to what the teacher is saying in order to build the mental models that create someone who is well educated. He says one of the keys to success is a digital Sabbath once a week. What does he say? A digital Sabbath every day, sometime when kids and even adults aren't being distracted by devices at all and are engaged in focused learning. So it'd be good for you to not even carry your device around, not even have anything for hours in the day. This digital Sabbath is a key to being successful. So a lot of people, when they learn about this, wonder, should I change my relationship with my phone? And will it be worth it making a change? Interestingly, the studies show the more worried you are about making a change, the more a decided change is needed. And so the studies are very clear. It is worth it. It is worth it to do what we're talking about today. So I wanted to give you that background because I know devices are a significant issue even in this great country of Zimbabwe. Those adverse effects are starting to happen and will be happening deeply. But you as leaders need to know about that and need to be educating others and then also ought to be acting accordingly. Any questions about this section? Yes. If we could have the roving microphone back. Right here.
Thank you. It's such a rescue. My question is now, I see people who are exercising, they have headphones, and I sometimes when working in the garden, I like to listen to something. And I was thinking of that question and I'm almost like answering myself that maybe it's not good. What do you think about that?
All right. So listening is often different than in regards to the phone where there's distracting elements. I must admit, in fact, it happened this morning when we were exercising. There is one app that I will use when I'm exercising, and it's an app actually put out by the General Conference of Seventh-day Adventists, and it's called Your Sabbath School Lesson. So you can press play on that, and you can hear this nice Australian reading the Bible and going through the lesson. And that's fine, you know, because that requires focus, and you're still exercising, and you're still outdoors at the same time, and you're not getting distracted by a device or things like that. Then, even better than that, after that lesson is read, you press play again. What's the play? It's the Ellen White comments about that lesson. And I've been finding that that's actually better than the lesson author's comments often. And so you'll get some deep, meaningful things there. And, you know, it doesn't take long. By the time it's all through, it's somewhere between 10 minutes and 20 minutes. And, you know, I exercise for an hour. And so it's not like I'm listening to something that whole time, but at least I'm able to get that lesson in for that day. So listening to something useful like that is helpful. We don't want to listen, we didn't talk about music. I don't think I'll have time to talk about music, but some music is actually suppressing for the frontal lobe of the brain. You don't want to be exercising and suppressing your frontal lobe at the same time. Some music is enhancing to the frontal lobe of your brain. It depends on the characteristics of the music. And so we want to be careful in regards to what we're putting into that brain. But listening, you know, even there's studies showing that if you take if you're watching an interview on a television set, or you're listening to the interview, or you're reading the interview in the newspaper, studies show that you will be much more fooled if you're watching it on television than if you're listening to it by ear. By the way, if you actually want to hear the contents of a presidential debate, don't watch the debate. Listen to the debate. Because there are things that happen during a debate that can actually distract you from the actual truths or errors or those sorts of things. And so listening often is far better than watching as far as your brain is concerned. All right, any other questions about this? That question over here on this side.
Do you think the devices that are given to young children make a difference and have increased the autism rate?
yes, could this make a difference in autism rates? Absolutely it can. Yes, so autism is really social, it's most characteristic of social deficits. And these devices lead you into social deficits. Because, you know, the interesting thing about it, there's also was a study showing how well you can read someone else's emotions. When you are continually on devices, you're actually a poor reader of other people's emotions. Why is that? Because you're continually seeing fake emotions. All of those pictures and images are fake. Even the Hollywood emotions are all fake. They're not real. And so if you get rid of that and you actually start interacting with people, studies show within 2 weeks your ability to read emotions goes up considerably. So it's our face-to-face social interaction time that help us tremendously. And this is one of the problems of our current generation. You know, the generation that I was in, these things weren't even available. If you wanted to be social, you had to actually be social. You had to be out there with people, and everyone were used to that. Now in the younger generation, it's like, wow, to have an actual face-to-face social interaction, that's too much, you know, because they're just used to limited aspects of things. And so, yes, that can be one of the things. It's not the only thing, but it is one of the things that are leading to higher rates of autism. And you'll often hear from parents, we didn't notice that they were autistic at all. They seemed to be fine. And it wasn't until they got older that we started questioning, are they on the spectrum? Are they autistic? Those are signs as well that it may have been induced. All right, any other questions?
Thank you, Dr. Nedley. I wanted to find out, is it possible to train our brains to selective attention or selective listening? Is our brain overcome by external things, or we are doomed? Are we able to train our brain to be selective on things that we listen to and see?
So yeah, I mean, the answer to that is yes, we can, of course. I wouldn't call it necessarily training. We don't want to necessarily be selective in what we're hearing, and also because if we're selective in what we're hearing, for instance, some people, even in regards to this presentation, could pick up on a line or two of what I said and twist it into something that was completely different from what I was trying to say, because they got triggered. You know, their emotions are so connected with certain things, they got triggered, and they were a selective listener. And so then they have all this emotional distraught. They actually start developing hatred towards someone who's actually loving, and all of those sorts of things. So selective listening can be very dangerous. But what trained them to be a selective listener? What trained them was, most normally today, the way they're relating to their devices, and the way they're relating to social media, and the sites that they're on that are triggering them to be, you know, in this area where they're not listening to the whole comprehensive message. And so these things will lead us to be selective listeners if we allow them to. And another thing that they will do is studies show that if you are relating to devices normally growing up, you are going to develop attention deficit disorder. These devices lead you to attention deficit because of all the distractibility elements there. So we're seeing ADD or ADHD rising significantly just as a result of how kids are relating to their devices and allowing themselves to be continually distracted. All right, well, you've been a very attentive group. It is 1 o'clock, And so it's time for the lunch break. We are going to have a very important presentation, probably one that you won't hear in Zimbabwe ever again, at least by somebody else, because I don't think anyone's compiled the research on this area, but it has a lot to do with our emotional health, our relationship health, our physical health, and we'll end with that section this afternoon at 2 o'clock. I'll turn it over to our leaders of the conference here. Thank you.
Copies of these books that we have here that were brought by the Nedleys. This one is The Lost Art of Thinking, and they are available here. You can have access to them to buy at the registration table. You'll be assisted. Then there is also Millie and her Tangled Thoughts. I think this one is a bit more for the children, but adults as well can benefit from this volume. The last volume that is available is Depression, The Way Out. So for some of you maybe that came a little bit later, you'll be able to find these books at the registration and get a copy for yourself. What I'm really thankful about is that when I was at school, it was during lockdown, and we had to get these books. And sometimes they'll take 6 months to be delivered, and sometimes when they come, you need to get a letter to go to the post office to get it. And when you try to get any book to Zimbabwe from the States, the delivery cost skyrockets. For example, one of the books here maybe is $40, by the time it gets to Zimbabwe, it might be $100. But God has just thought of us, and the books are here without the delivery cost. So please make use of the opportunity. Then the announcement that I have is that there's going to be a Vespers program tomorrow. That is Friday sunset at Highlands Church. Highlands Church in Enterprise. Dr. Nedley will be speaking there from 6 to 8 in the evening. And the whole Sabbath at Highlands Church, there's going to be a mental health program. So you may be interested to attend, as well as invite others to come through. May the Lord bless you as you enjoy your lunch.